Hi, I'm Dr. Elizabeth Roy. Thanks a lot for joining me. I want to have a quick discussion about hormone balance and natural hormone replacement for women. This is a hot topic and everybody's talking about it. I have been helping women optimize and balance their hormones for many years. Now, optimization simply means that you feel your best, you are functioning properly, you are safe, and everything is working as it should. Just because you're within the normal range, which you'll hear a lot, doesn't necessarily mean you're optimized. Maybe you don't feel well. Maybe you're having lots of hormone-type symptoms like sleeplessness or hot flashes, night sweats, irregular periods, painful periods. Maybe your mood is off, maybe a little depressed. Perhaps you can't seem to lose weight. Maybe you can't build muscle and you're in the gym trying to do that. There's lots of reasons why a woman might have hormone imbalance, and there are a lot of symptoms that are associated with hormone imbalance. So optimization means that we listen to your story, and from there we can really understand within this whole symphony of hormones and this monthly event that occurs, what might be the problem. Then we measure, we replace, and we monitor, and that's key. So when we measure, not only are we measuring your hormones, but I'm looking at some of your genetics to see if you are actually at risk of developing a breast cancer. Maybe your mom and your sisters and aunts have not, but perhaps you're at risk because of genetics and the environment, the way it's polluted, some of your lifestyle habits. We're going to look at that. We're also going to look at hormone metabolites. So once we get you on the proper doses of hormones, we're going to look to see if you're metabolizing them safely and properly, because we can actually influence that with some natural substances. Sometimes we change your diet. Sometimes we give you DIM or I3C or some methylation. If we know what's happening, then we know how to interfere and how to correct these problems. I only use what's called bioidentical hormones here at Doctor's Studio. These hormones are exactly identical to the hormones that your body makes. So your body knows what to do with them. So this is a safe, natural way of replacing. Now I say safe, meaning we monitor, we make sure we're in appropriate levels, and we know what's happening. Women who've never taken hormones can develop breast cancer or endometrial cancer. So there is an environmental component. So we look to see what might be going on, what we might need to worry about, fix it, correct some of these underlying dangerous metabolic pathways, and then we go from there and we dial it into where you feel great, you look great, you're able to maintain your body weight. We are talking about improved energy, sleep quality. All of those things lead to longevity, better quality of health, greater sense of wellness, healthy libido. Testosterone, by the way, can't leave this conversation without talking about how great testosterone is for a woman. It is our primary hormone, though we don't know that, we don't think that, we don't realize that. We think about men and testosterone. Women have more testosterone than they ever do estrogen. And it's especially important in our perimenopausal and our postmenopausal years because it helps us with our bone density and our brain health and our energy and our outlook and certainly our libido. So let's optimize your hormones. Let's do it in a very smart and respectful way. Let's use science and an understanding of how the body works to guide us. And we will titrate these doses in a very effective way to get you feeling maybe better than you felt in years. Go ahead and call the office, schedule a consultation. We'll sit down and talk about how to go about helping you. Thank you. I look forward to meeting you.